Assistant Professor of Medicine at Mount Sinai Hospital in New York. Doctor, good to see you again. Thank you for your time on this day. So reports of racial disparities are very worrying and upsetting, obviously. Outrage after residents at a Latino neighborhood saw vaccine appointments taken by people who don't even live in that area. Help shed some light from your personal perspective. Are certain parts of the population being favored over others when it comes to inoculations?
Definitely, this is a glaring example of racial inequalities when it comes to healthcare and access to vaccine. This center was opened on January 14 for the purpose to serve a very hardly hit Latino community. And when they opened this center, the enrollment kind of filled in with people from outside of the area, and they ended up vaccinating more white people. And as the mayor said, this incident is definitely outrageous. We cannot leave the minorities behind. They are suffering most. They are being hardest hit in this pandemic, and we should make sure they are having equal access. However, this incident has been addressed, and over the last few days, I would say that they have vaccinated 80% of the people being local residents.
How has it been addressed in the sense that who is the person responsible? Who takes responsibility for making sure that the right people are getting the vaccines in the right places?
I think it had to do with the enrollment process. They didn't have enough screening when it comes to where these people are come from, what race they are. So initially, when people are enrolling, they're able to come from different areas of the city versus restricting it to the local residents, which they fixed later on.
Now, Doctor, the last time we spoke, there was grave concern over the number of states struggling to administer the vaccines they have. What is the latest in New York? How is the process going where you are at the moment?
We definitely had a zigzag start when it comes to vaccination. And comparing with Israel, where they are a global leader, they almost gave 30% of the population at least one shot. In the United States, we're on average 7%. And here are a few concerns. That's why it started. We did lack of infrastructure. We do have a fragmented healthcare system. We had a lack of federal centralized planning in the prior administration. We had a lack of vaccine. But in the positive side, we're seeing a good movement out there. Over the last week, overall in the country, we had an average of 1.3 million vaccines daily, which would make the Biden plan from 100 million vaccines in 100 days totally reachable. I would love to see 2 million vaccines daily, because sooner we crash this virus, sooner we prevent further mutations. And also, Biden administration has implemented some changes, deploying the Defense Production Act to address the bottleneck in the supply chain, securing 200 more million doses, and also flowing the money from the stimulus. They're finally reaching the grounds, and we see more people being hired, more vaccinations being, vaccine centers being opened.
As you say, it's been a bit of a zigzag process. Given the concerns you've raised at the current rate of inoculation, how long could it take realistically for this massive operation to ultimately vaccinate over 300 million people across the U.S.? What are the likely timeframes?
We're definitely more optimistic at this point, and we're looking for over the next 3 weeks to see a 20% increase in vaccine supplies. So if we are keeping up with the pace of 1.3 million daily, hopefully reaching 1.5 million people vaccinated on a daily basis, the goal is by this administration to be able to vaccinate the whole population of the United States by the end of the summer.
And here in Israel, Doctor, teenagers from 16 years upwards are being vaccinated. What are experts there saying about children even younger than that being inoculated? Is it necessary, in your opinion?
We don't have any scientific data yet, and the lack of evidence doesn't mean that's not implementable in the future. It's just we don't have enough participants in the studies. Moderna had people under 16, Pfizer above 18, but there are current studies going on with children over the age of 12. So I think in the next few months we'll have more answers, and we'll be able to include this population as well.
Well, it certainly is an ever-developing story. Thank you so much, as always, Dr. Luiza Petre, live from New York. We always appreciate your insights. Be well. So let's turn our focus now to the